Hello everyone, I am Dr. Divya Grace. I am a pulmonologist. Today I am going to start with the same scenario that we have discussed previously in the previous video. In that I was describing a woman who was having cough since 3 months, but she has never smoked a single cigarette in her entire life, yet she was diagnosed as stage 4 lung cancer. The reason is second-hand smoking. This is also called as passive smoking. She had a history of passive smoking, that is for 45 years. That led to her stage 4 lung cancer. Let's discuss about passive smoke. What exactly is passive smoking? If you are non-smoker but you have friends or family or anyone beside you who is smoking all the time or most of the time, you are being exposed to the same smoke that he or she is being exposed. So this is considered as passive smoking or second-hand smoking. In such cases, passive smoking is considered as highest risk factor for a lot of lung diseases as well as lung cancer. For example, when you compare with non-smoker who has never smoked a cigarette in her entire life and a person who has been exposed to passive smoking, the risk of lung cancer is about 30% high in the person who has been exposed to passive smoking. Apart from that, also coronary artery diseases such as heart attacks, the risk of heart attacks in a person who has never smoked in his or her entire life and person who has been exposed to passive smoking, the risk is also 30 to 40%. So in this scenario, we can understand that if you are exposed to chronic long-term smoke and if you are a non-smoker, then you have the highest risk. So it is better whenever you have any environment that is affecting you in this, please avoid being in that environment. Please ask them to go outside and smoke, or at least do not stay in that place. Thank you.